Well, I wanted to spend a few minutes this morning and talk about the purpose of innovation. And I think the discussion just a few minutes ago was very insightful on the how. And as we know in healthcare, we have to change. And change has been put in context of better experience, but affordability. And affordability, as we think about it in today's context, healthcare has gotten out of whack. I was in a meeting a few weeks ago with a consultant, and he indicated that the average income, and we saw this week, actually increased a little bit, for Americans is about $57,000. But 25% of their gross income today is spent on healthcare. 25%. Back in the 60s, healthcare was about 5 to 6% of GNP. Today, it's about 18%. So it has become a very large part of our society and a burden for most families in the United States. We can blame this on chronic conditions. We can blame this on waste. We can blame this on growth in science and all the other aspects that have increased healthcare. But I also believe it's how healthcare business works. And I'm going to spend a few minutes on that because what I'd like to do is at the end of my conversation with you is to talk about a different measurement of success. This is my dad. His name is Willie. He is 77 years old. He is one of the seniors in our United States today, of which 10,000 age in every day in Medicare. Close to 80 million will be in Medicare by 2035, a significant growth. He was recently diagnosed with bladder cancer, and that is a result of him smoking 30 years ago. He hasn't smoked since. But as we live longer, our chronic conditions begin to start exposing themselves as a result of lifestyles early on in our life. Now, some other statistics about my dad is he still works. He has a purpose, and work is one of his purposes. He has a dog named Sam. He loves walking his dog in the morning. But also, my dad has not been to a primary care physician for close to a decade. And if you think about our system today, it doesn't motivate the healthcare system to engage actively in preventative care. Because people don't get paid for it. We have built an episodic system over the years. In addition, the healthcare system doesn't know my dad. Doesn't know that he works, doesn't know that he walks his dog, Sam. Again, it's because we're not motivated as a healthcare system to do this. Now, as I think about the future of healthcare and the changes that are on the front for us, we can change this. I'm a big believer in the ability to move the system to look more holistically at the individual through payment reform. Data flow and velocity will continue to increase our insights into individuals, both conditions, but also the person. Combined with that, I think we'll continue to increase access points as technology, as remote monitoring, telehealth, and others become more at scale. But how we put those to work is really the challenge I ask all of us, is they're not individual, just like healthcare. I believe, and this is really the sense of my presentation, is that we have to change the definition of success from these different items and initiatives to the personalization of healthcare. And items like value-based reimbursement, data, convenience can help with that. Now, I hope as my kids see the healthcare change over the next decade, I hope the conversation with a physician's office will be something like this in the coming years. I will go with my dad and they will call him because my dad is needing a trusting relationship. At Humana, we've taken our 4 million members that we have and we've divided them and segmented them into personas. And these personas are not about their conditions, it's about how people engage in health. My dad would be defined as a control seeker. He's stubborn. He has to control his destiny. And he has to have trust. And so the conversation with him isn't a postcard, hey, we want to schedule your primary care visit. When would you like it? It would go something like this. Willie, it's time for your primary care visit, your annual physical, to ensure everything is okay. We know that on Tuesdays you have your staff meeting with AT&T. And in addition, we know you walk Sam every morning at 8 o'clock. Would it be convenient for you on Wednesday at 9:30 to go to a telehealth facility 1 mile from your house? They acknowledge him as a person. They've personalized the conversation. And I know as I see it today in Humana, it is a great opportunity for us to begin to change how we look at individuals in the healthcare system. And we don't look at it as initiatives, we look at it as a person. Now, I've seen this in other parts of healthcare, and I'm going to change a little bit from preventative to more viewing as holistic. As we all know that lifestyles is such an important part of health conditions. And if we are able to have providers and other health organizations focus holistically on individuals, we can have an impact on individuals' lifestyle. Now, Betty is an individual that I met about a year ago. We have an organization called Humana at Home, and these are individuals that go out and meet with our members at their home to ensure that their care is proper and their lifestyles are supporting their needs and health conditions. So I went with one of our nurses, and I visited Betty. Betty lives in South Florida. She lives in a very unsafe place. Her house has bars on it. She's under-resourced. And when I went in there, we spent about 30 minutes, including going through her meds, seeing her what kind of food she was eating, ensuring that an individual that we called installed the shower bars for safety in her, as she bathed. And as I was leaving, I asked the question to her, what else could we do? And she said, I'm lonely. She didn't have access to transportation. Her children haven't visited her in 2 months. And so she was secluded in her home. Now, loneliness is impactful on health. It impacts your health significantly. So as we left, I asked our nurse to get transportation, find a social community, of which we do this a lot. In southern Florida, we have a lot of clinics that actually have social communities inside the clinics. Maybe many of you in some of our areas might see our guidance centers where we have communities where people come in. We have cooking classes, we have computer classes. I was in the Las Vegas one recently, and they had a knitting class to give blankets to the local cancer kids. Why can't we give a prescription for loneliness? If we were able to change the dialogue from a treatment mentality to a holistic view, there would be a motivation to provide that. For us at Humana, we have that motivation as a result of being in Medicare Advantage and having payments that are organized to the holistic side. But I do believe as healthcare evolves, changing the payment to a much more holistic approach. Now, I am excited, as I mentioned before, over the next decade that healthcare is going to materially change. And it's going to change because I do believe technology is going to have a large impact on what we do. I recently was able to spend some time with one of our other members. This is Robert. Robert lives in North Carolina, still married. His wife is alive and active, but Robert loves woodworking. But Robert, over the years, his balance has become unstable, and sometimes he falls. In addition, Robert has CHF. And so his wife feels very uncomfortable letting Robert go to his wood shop. It's down the road. He lives on a few acres. And so, as part of a Humana program, we offered Robert a device that would monitor his falls and also monitor his CHF. In addition, within our organization, we've created a lot of connectivity and has a lot of data analytics that both predict falls and, in addition, when a fall does happen, is there to be able to respond. When weight gain because of fluid buildup from CHF or due to CHF, we're able to monitor that. So what's happened is Robert now feels comfortable going to his workshop. His wife, also has a sense of relief, knowing that she will be contacted as well as Humana will be contacted if Robert was to fall. And we, of course, as part of the healthcare system, have also created preventative cost. And so as we think about this ability to impact and personalize, the future is bright. But when focused on the personalization as opposed to just the cost, the impact is greater. So it's the how we do this is the difficult part. Because the healthcare system has been built over the years to be very fee-for-service oriented, to be very institutional, and be very siloed. We have to change the conversation from treatment and episodic care to health. Have to change the focus for us as a company, for example, from a cost per month per member to improving healthy days. The definition of success has to change as we think about making change in healthcare. The other part is what we have found in our organization to begin that change. The cultural part has to change. A number of years ago when I came to Humana, I was asked the question, Bruce, are we in Medicare or are we a wellness company? I said, there's no difference. And it really hit me by saying our associates, 50,000 of them, do not fully understand what we're trying to accomplish. And so we set a goal, a port along the way of our journey, tried to create clarity. A goal goes something like this: to improve the communities we serve by 20% by 2020 through making it easier for people to achieve their best health outcomes, and simplicity. And that simple goal began to start to change the conversation about we're not an insurance company. We're a company to improve the health of the communities that we serve and to make it easier for people to achieve their best health. That has dramatically raised our engagement scores. Today, we have engagement scores of around 93%. We've also built values around that: inspire health, pioneer simplicity, thrive together. Those things have begun to change the way the organization focuses as a measure its success. And recently, I saw this come together by an individual by the name of Stephanie. Stephanie is a member of ours that is in the Kentucky, Indiana area. And about 4 years ago, Stephanie was at home with her 2 children, and a tornado came through. As the tornado came through and the tornado warning was launched, she went downstairs into her basement, covered her children with a blanket, and the first tornado came through and took her home off her foundation. An I-beam fell on both of her legs and amputated her legs. The second hurricane came through, and the debris from the first hurricane was laying around, and that debris hit her multiple times and broke her ribs, caused some heart damage. 4 years later, she's gone through all the rehab. She didn't lose her legs. She now has prosthetics. But she gave a letter to one of our associates and said, "Can you give this to somebody that maybe can help me?" I knew nothing about this until the day she wrote the letter of what we did for her. And the letter asked, could she get sports prosthetics? And the organization responded within 3 days and gave her sports prosthetics. We had already paid for regular prosthetics. And we were the first organization to offer sports prosthetics to an amputee. But my point of that is that the culture began to change the focus from cost, PM kind of conversation to improving people's health. And that was a demonstration to me that is so powerful. When you get 50,000 people walking in the same direction and believing in the same, the impact you can have. The second thing as I thought about the circumstances is the definition of health began to change to be not what we define it in the healthcare system, but how the person defines it. Prior to her accident, she was a runner. And so her definition of getting back to health wasn't about just functionally walking. It was about getting back to running. So I hope I've left you with some ideas about why we need change and why we put change to work. And I do believe through changing reimbursement, through leveraging data and analytics, and increasing the interoperability of data through our system, along with innovation and access points and simplicity of the consumer, will make an impact in healthcare. But the impact should be on personalization. Now, what I have learned about innovation over the years and change is you do have to put a goal out there and move it, and move towards it. And I'd ask each of you to take baby steps. As leaders within your organization, is to take baby steps of change, set goals. We in our organization have set goals in 3 large areas. One is around the ability to have value-based reimbursement payments with providers. We've set the goal of 75% of our members by 2018 are in relationships. CMS has done the same. Actually, CMS followed our goal setting. Think about if you have that opportunity. The second is the flow of data. One of the biggest problems in healthcare is the structural silos that we have. A good friend of mine, John Scully, the former CEO of Apple, made a comment to me over dinner one night. He says, I feel like the healthcare system is like the personal computer industry in the 1980s. And I remember that. I had a Macintosh. I was in grad school. And I remember taking the disk out of one machine and having to go and put it in another machine. And as I left that dinner, I said, gee, you're right. Healthcare is just a bunch of single Macintoshes. For us to be effective, we have to bring healthcare together. And so what I'd ask you is, how can you facilitate that connectivity? We in our organization have set goals of having interoperability relationships and using the standards that are out there, FHIR, HCL7, and other standards, but creating business models to create connectivity. And then the last one, which I know Mayo does a wonderful job on, is to support innovation of small companies. Find companies that are doing really neat things and try to bring them into your organization. Because those companies need help from big businesses to succeed. Because one of the challenges in healthcare and in innovation is that the business models are really difficult because they are so dependent on fee-for-service. But the ability to connect with these creative companies and bring them alive is going to make healthcare better over the long term. So I will conclude by saying healthcare has a lot of opportunity. I am excited about the next decade of healthcare because the combination of changing payments, combination of data and analytics and technology is going to have an impact. I would ask you, how do we use that? And my hope, I've convinced you today that personalization of the care and the engagement is going to have a large impact on being able to make care affordable in the long term. So thank you, and enjoy the rest of the day.